Sure. Thank you very much, Beth. So in terms of the next step of this project, I think Marina has kind of mentioned already in her talk earlier, that we are planning to scale up and extend our care economy research to more global and comparative level. And in fact, already many of you in this meeting have been involved in this. We have been working together for the last couple of years on the next phase of the care work and economy project by finding ways to adapt and innovate on the kind of research that we did in South Korea to other countries. And so as the discussions yesterday pointed out, it will be really important and interesting to do this, to extend this research to more sort of lower, middle, and higher income countries, taking into consideration different social, economic, cultural, and normative contexts. So in the forthcoming research project, which has been really generously funded by a number of funders, including the Hewlett Foundation, Open Society Foundation, SSHRC, the Social Science and Humanities Research Council, and others. I'll mention a little bit more about this later. We will be looking at the care economies in context, and in which we'll be adapting and innovating our current projects, research methods to 8 different countries in 4 global regions. They are 2 in Africa, Kenya and Senegal, 2 in Latin America, Colombia and Costa Rica, 2 in Asia, Sri Lanka, Mongolia, and 2 OECD countries, which are Canada and Italy. We're hoping to use similar research methods that we employed in the South Korean studies, in addition to undertaking the literature and policy review of care work and care-related policies in these countries, we're also hoping to conduct 2 large questionnaire surveys, including time use surveys of the care workers and surveys of household caregiving and care receiving, and a largish in-depth interview surveys of caregiving and care receiving. So with the purpose to get more sense of care contexts and infrastructures in these countries. We then plan to use these empirical data to develop macroeconomic models. I'm hoping that this new research project will have a number of policy and research impacts. First, I think this new research will enable us to collect more up-to-date, more nuanced, and more finer-grained data about care work, family, and gender dynamics, and the impact of the COVID-19 on the care economy. It will then also allows us to analyze the nature and mechanisms of the care economy and their interactions with policy, institutions, and cultures, and at the both national and global level, and as well in a comparative perspectives. Secondly, I think this new research will also allow us to contribute to various national global policy dialogues and policy developments in various other countries involved. For example, in Canada already, where the national government has already made it clear their commitments to the care economy, largely because of the COVID-19 pandemic, we are already talking to the governments about the data collection and policy options. I know that governments in other countries, such as Colombia, Mongolia, and others, are also interested in understanding and developing better policies in this area. Also, I hope that this research will help inform, support, and energize and contribute to the civil society actors and other key care actors in their policy, community development, and mobilization activities. And then finally, I hope that this new research will bring together different care economy actors that ranging from local to global levels to work together and continue to our care economy agenda. I should also mention that there are a number of people and institutions involved in this project. First, I want to really mention that this project has already received fundings from Social Science and Humanities Research Council of Canada through the Partnership Research Grant, and the University of Toronto for providing kind of overall project and project funding and student training support. We also have received really generous fundings from the Hewlett Foundation for the African portion of the project, and the Open Society Foundation for the feasibility studies and other continuing support. I know that Open Society Foundation has also funded several other projects separately, sort of in Colombia, and of course for South Korea. We have just submitted we have been actually invited to submit an expression of interest for a new funding from the IDRC in Canada. I just want to mention that we've been really fortunate to receive a lot of sort of support and fundings from our institutional partners. In a little bit more detail, we have research teams in the 8 countries that we're studying that are led or co-led by 1 or 2 research leads. Many of them are here in this meeting. I would not name every one of them because that would take long, but simply to say that many of you have been part of this new project, and we will be working together. I'm so glad for the next several years. We also have important national and global institutions who are partnering with us in this project. And this includes UN Women, UNOISD, ILO, and various national statistical agencies such as Statistics Canada, and various national central banks, and as well Levy Institute, and other universities and research think tanks. In Canada, the Canadian government and NGO partners also includes IDRC, Women and Gender Equality Canada, Canadian Labour Congress, Child Care Resource Centres, and several other NGO groups. So, so these partners and co-investigators, they will have very diverse roles in this project, including providing us with not just funding and in-kind support, but also advising us, providing governance for our project. Some of these institutions are also helping us with research design, data collection and analysis, and information sharing, training, and knowledge mobilization and communication. So we'll be working very closely with not only the co-investigators and collaborators, but also with the partner agencies in local, national, and global level. So I just wanted to say I'm really excited. I think we are heading to a really exciting project. And I totally agree with both Althea and Marina that this is a moment. And I think in which COVID has opened that political, social, and economic openings but it's a narrow corridor. So we really have to move forward quickly before that corridor door closes on that. So again, this is just update on what's coming next. Thanks.
Thank you very much, Ito. Just listening to you, that's huge. That's a huge agenda, and how many parts you will have to be coordinating, consolidating. You're very brave.
and I will continue to need all your help. So I'm saying thank you in advance for your help and support.
Thank you very much, Ita. And so then we will be hearing from Isabella Aboderin about the Africa parts of this new project. Isabella, please.
Thank you very much, Beth. And it's really nice to see so many of you again, albeit on screen, but I hope we'll have a chance to meet in person again soon. So thank you very much. So yes, you've already alluded to it and Ito has touched on it. We have been able to, if you like, take the core of the QIGAM project and its idea and build on that to fashion what will be a program of care, of research and policy engagement on care systems and economies in Africa that very much speaks to the particular realities, contexts, policy debates and opportunities in the continent. And before I go on to describe some of the details of that, I just wanted to express my gratitude, first of all, to Sergi and the QIGAM team for bringing us into your discussions so generously, in Berlin first and then in Glasgow. And without that engagement, without the connections forged, I don't think we would be here today. We wouldn't be talking about this project. And secondly, of course, gratitude to Althea and the Hewlett Foundation really for making this possible and agreeing to fund our project. So I spoke about the fact that we've built on the QIGAM project to really fashion it in ways that speak most to what we think are African realities and challenges around care, particular ones for the continent. So first decision we made was to focus the project specifically on two elements of care, care at both ends of the life course and the intergenerational dynamics across those. So care, early child care, as well as long-term care for older adults who are no longer able to live independently without the help of others. We also decided to make this explicitly a two-country project focused on Kenya and on Senegal, but with an explicitly regional focus, which means that we will explicitly engage constituencies, both research and advocacy and policy constituencies that act at the continental levels as well as the sub-regional levels. We think this is very important to go beyond the national level. And secondly, you've already alluded to it. I guess the same applies across the world. We feel that within the context of COVID, we might be at a critical juncture where the status quo as regards those two elements of care, is really seen increasingly as no longer being tenable, the gaps in the systems being laid bare by the pandemic. And as a result, we really have a sense from discussions with our policy partners that a space is opening up, not only for thinking about and envisioning policy change on care, as part of the broader debate around how to reset and reorient Africa's social economic systems, but perhaps even a space for galvanizing action in the right direction. And so I would say that our project really is oriented towards informing, hopefully, and galvanizing policy change. And the three things that we want to aim to accomplish in that regard is first to generate incisive and Africa-centered knowledge. That's very important. Africa-centered knowledge that clarifies the case and the directions for policy and investment to expand early childcare and long-term care provisioning and infrastructures. But we want to go beyond that. So we want to go beyond generating that body of evidence to really foster the consideration, the understanding, the embrace, and the use of the knowledge that we're generating by key regional and national policy and decision makers and other political actors. And for that, we're going to work actively to bring together and engage advocacy coalitions around this issue of care. And then lastly, and this is also very important in the context of ITO's global project, if you like, is that we want to embed Africa as the locus of generating knowledge on care in the continent. So advance a flourishing African scientific endeavor on care that can not only sustain policy change in the longer term, but also advance and really, I think, open up global debates in the field, including theoretical and conceptual debates around care. I won't go into the work packages, Beth, unless you want me to, but I'm conscious of time. Maybe just to say that what's also important about this project, that this is an Africa-led consortium. So the African Population and Health Research Center is the lead. Other partners in the consortium are the Regional Center of Excellence in the Generational Economies. I'm not sure if Latif is here, but you will have met Latif. Then there is the University of Bristol Perivoli Africa Research Center. That's my center. The University of Toronto, obviously Ito has spoken, as well as, and this again is very important, the NAWI AfriFem Macroeconomics Collective, as well as the Institute for Economic Justice, which really will inform all areas of the project. And so we feel we have a really not just an excellent consortium, but a really excellent basis as far as the context is concerned to make this project, I think, the success it deserves to be. So Beth, if you want more detail, I'm very happy to share.
Yeah, thank you very much, Isabella. And I think we might have a few minutes for questions later, so if people have other questions. So the third star in this constellation of the next care and economy project is Ana Maria Tribin, who will talk to us about the plans for Colombia. Ana.
Hi, Beth. Hi, how are you? Thank you very much for inviting me to this amazing seminar, because it has been very interesting. So with Natalia Ramirez, Paula Herrera, and me, we have been working in adapting the care economy project from South Korea into Colombia. Maria Floro inspired us to start this project, and with the generosity of Open Society, we have been working in this for several months, and we're very happy with the results we have been seeing. Our idea is to land research in such a way that it talks with advocates and policymakers. We have now, our project name is Quanta. We have a web page where we provide the public with qualitative and quantitative tools, so people can empower themselves with all these tools to promote gender equality. We have been seeing that there's a space right now for this. We are very happy with this project because policymakers in Colombia right now, we have a huge problem with gender. The gap between men and women have been going is huge right now. We have unemployment of 18% for women. That's very high, and for men it's 10%. So we have to do something about women, and also women are not participating in the labor market. Now the participation rate is about 47-48%. So most of women are not participating. A majority of women are not participating, even though that in Colombia, women are have more education than men. So that is completely ineffective, no? So the policymakers are worried with the situation, and we have been talking with them and providing with a lot of tools. For example, we are studying the use of time during COVID. We are carefully monitoring paid care and domestic work during the pandemic. We have also been interviewing women to know how they are dealing with all these tasks at the same time. And we have several reports, papers. We have been doing these workshops, providing people with files in order for them to download all the data from the National Statistics Department, so they can work with the data and find out all the gaps using our files. So this has been very, I think we have a strong voice right now, and we have a space that was important to fill, and we are doing that. Also, for example, last time the mayor of Bogota was talking about proposals for encouraging women to join the labor market, and she used our reports in her presentation because no one was doing that. So we are doing that. And she obviously invited us because she needed help to think about what to do. So we are encouraging policymakers to start using our tools, and also having this conversation and making this topic relevant for a city or for a country that wasn't thinking about this topic before. Also, we have been talking with the central government. The National Development Department called us, and they want to use all our tools. They are looking forward to use the macroeconomic model, because when they are doing all these policies, they want to show people how this change men and women life, because now people are aware of this problem for women, and they always show everything for the general population. So I think with our tools, they can show that it's important to invest in care, and also all the things that they are doing, how it affects differentiatedly men and women.
Thank you very much, Ana. Thank you very much. So I'm sure there are many more things to share with people. So I'm opening, let's give a few minutes for questions and answers, yeah? So let's see, we are supposed to end at 10, but I've just gotten the go signal from Shireen that we can go a few minutes over, just because there will be questions for the next steps, for Ito, for Isabella, and for Ana Maria. And then we will hear a few last words from Sergi. So any questions at this point? Althea, is that you want to ask a question?
Also,
Sorry, who are the people who want to ask questions?
Sounds like Luisa.
Luisa.
Hi.
Luisa. So Althea, did you want to ask a question too?
No, is my hand raised somewhere?
Oh, it's because you were not muted, so I thought you would.
Oh, it's just
okay.
how I'm connected.
Luisa,
Sorry.
Yeah. So Luisa, go ahead.
Thank you so much. This has been extremely interesting and helpful to hear. My question is for Ana Maria. I'm from Brazil, and I've been thinking a lot about this in the context of Brazil, and a lot of the work that is done in other regions did not really help me think of the specific problems of Brazil. And I think Colombia is closer structurally and in many senses. So I was just wondering, you said you've been using the work that has been done in Korea on your own work for Colombia. I was wondering, what are the main differences you found? What are the things that you're having to do novel research on and adapt to the context of Latin America, or specifically Colombia? And
Excellent.
congratulations,
Well,
it's really interesting the work you're doing. Thank you so much.
excellent question, but let me gather before, Ana Maria, before answering that question, let me just see if there are other questions on the floor, because we don't have a whole lot of time. I just want to, can you, if you have a question, you want to speak up? Because I don't see everybody. Okay. All right, Ana Maria.
Okay. Well, there are a lot of difference. For example, we have one of our big problems is that the informality. So we have a different labor market setting, no? So we have to understand that there's a huge part of the labor market that is in the informality, and those dynamics are different. Sometimes some of the, for example, if you think about a maternity leave, that is just for the formal sector. So if you start to advocate for maternity leave, you end up advocating for a small portion of women, no? But and also in South Korea, they are aging, and in Colombia, we still have a lot of issues with topics related with children. If you see at the data, for example, we made this exercise looking the probability of being informal, and for women, the probability of being informal increases with children, but not increases when you have people over 65 years old. Because if you look at the time use data, a lot of the people that are over 65 years old, they are caring. So they are helping youth, or like they're helping the mothers to go out and work. So there are very different dynamics, and therefore it's important for us in the model to address that we have informality, for example. We also need all this with macroeconomic analysis and also qualitative analysis of what is different, because we have to be aware that it's an adaptation, is not just copy paste. So there's the different things that you have. Also, I wanted to mention one thing is that Colombia and Latin America is the only place that has the survey of use of time that was done during the pandemic. So we now have information about the effects of the pandemic in the use of time. And we have all this data, and we are processing all the data to show people how the pandemic impact women in Colombia, and how this is related with the results that we see in the labor market. Just to mention something that we have been seeing is that for passive care, women double the time. So they are doing a day 5 more hours, while men are doing only 40 minutes more a day. So that is outstanding.
Thank you very much, Ana Maria. Luisa, I hope she had responded to your question, and I'm sure the two of you can get together more directly to learn more about what's going on. I just want to ask one question.
Could I just add to, could I just add to what Ana Maria had said, because we had a chance to meet and talk about sort of the adaptation just before the COVID-19. And one of the things that really surprised me in terms of the difference between Colombia and South Korea was Ana Maria mentioning to us, sort of, in addition to the kind of difference that she mentioned, also the amount of rural to urban migration. And as well, Colombia now houses something close to 2 million Venezuelan refugees. So you've got, in addition to that, the migration sort of component that needs to be taken into context, and the very different regional and ethnic diversity within Colombian populations. So I think Ana Maria could explain some more.
I think that's key, and I didn't mention that we have this inflow of Venezuelan migration that it was in a short time of 2 million people from 2016 to 2019. And we are also studying this because it's important to study in our project. So we are thinking about this care chain, and we have seen different things that what is found in United States. In United States, you see that with the migration, women with high education are participating more. You don't see this in Colombia. The early things that we have been seeing is that because there was already enough offer of domestic work, woman, there's no change for women with a high education. You see change in women with low education. They start to participate more. So I think this is key. And I also forgot to mention that we are with Ito in this effort to globally make people aware of care economy, that I think is amazing.
Thank you, Ana. Thank you, Ana Maria. Ito, I just wanted to ask, when are you planning a launch meeting? You and Isabella and Ana Maria for the next project. That's the last question that we have time for.
Thank you. Yes, we're planning to do the launch meeting. We just found out that we received a SHIRC partnership research grant last month. We had initially thought about, well, this was, well before the COVID. We were thinking we will have in-person, like bring people together to Toronto, but I think that's not going to be possible. So we might have some kind of hybrid meeting. Sometime either toward the end of this summer or early fall. We are still working to put together the administrative teams, even though we have a lot of students sort of really eager to start. We need to just put together the administrative team first. Yeah, so we will, yes. And so you get invites.
So we will wait for that. Congratulations again to the three of you for making sure that we have an important effort to continue this work on the care economy. And good luck, Ito, Isabella, and Ana Maria. So as our last speakers, we're going to hear a few closing remarks from Sergi. Sergi, the floor is yours.
Thank you, Beth. First of all, listening to our previous speakers, I recall a few years ago at the first annual meeting, as Isabella mentioned, of this project held in October 2018 in Berlin. There were two fascinating presentations made by Ana Maria Tribin and Isabella Aboderin. Both made a strong case that a research project on care work, the economy, and homegrown development should expand in Colombia and the Africa region. Ana Maria argued that Colombia is a middle-income country where it is imperative to start working on the issue of care economy. Isabella set out the rationale for adaptation of the Care Work and the Economy project in sub-Saharan Africa. She argued that the project's theory of change poses that gender-sensitive care policies will propel a set of transformative outcomes in the region. Then in June 2019, Ito, Beth, and I had a series of brainstorming sessions during the Gender Care and Migration Conference held in the University of Toronto. We explored ways on how to better understand the organization of care economies in varying contexts. And born of that informal discussion is this one initiative led by Ito Peng on the care economies in context. Along with other researchers and regional and national policy and NGO partners, all three of them worked very hard to make their vision a reality. The road towards our common goals is still long. Through these initiatives, I see this community expanding, bringing in more scholars and advocacy groups and partners from the South and the North in these adaptations of the Care Work and the Economy project. Because the ways that we envision and provide care will have immense consequences in achieving and also implications for attainment of economic and social justice, gender equality, and sustainable development. I believe that these initiatives and more to come will ensure that access to the highest quality of research and to assure that the findings of their research reach the audience that is most able to use them to bring about change. Finally, I want to say some word of thanks to the people who worked behind the scenes, who made this project possible. I thank the founders earlier, as well as the researchers and other people involved, but I want to acknowledge in particular the American University Program on Gender Analysis and Economics, where this project is based, and the work of our wonderful communications team and RAs, Beth, Shireen Arslan, whom you know very well already through your communications with her, Jennifer Brown, Glenn Quendy, Catherine Hensley, Catherine Falby, Ana Herrera, Pravina Bandera, Hannah Randolph, and other RAs whose work in disseminating and overseeing the logistics and technical aspects of this annual meeting, and as well as the communication and dissemination strategies, have been invaluable. I want to thank you all for coming and joining us in this final Care Work and the Economy annual meeting, for the excellent presentations and valuable input and insights that you have shared in the discussions. It has been a wonderful journey, and we will continue moving on forward together in different ways. But I think this meeting has gave us many food for thought, a lot of innovative ideas and suggestions for future initiatives, as well as some deep questions to ponder. We will send in a week or so the summary highlights of the annual meeting, as well as the web links to the video recording of the 3 days of the meeting. I hope to see you virtually in a couple of weeks at the forthcoming Center for Transnational Migration and Social Inclusion, as well, and together with the Care Work and the Economy project, who will be hosting the Policy Dialogue Conference in June 1 to 3 East Coast time and 2 to 4 Korean time. Have a wonderful summer.